Most of us have heard about the most lethal form of skin cancer, melanoma. What many of us don't realise is that melanoma only accounts for 5% of all skin cancer cases. Most of the remaining cases are either the basal or squamous cell forms of the disease, which until now were only treatable with somewhat invasive surgeries that can cost thousands of dollars.
Treatment options for skin cancer till now have been almost entirely surgical. There's surgical removal. There's a more complex surgical removal called a Mohs surgery, MOHS, but again, it's surgical.
Scientific testing has led to the discovery of a non-melanoma skin cancer treatment in the form of a cream called BEC5. The cream has undergone double-blind placebo studies in skin cancer clinics in the United Kingdom.
Findings of the studies done in the UK, and there were 8 centres, all headed by dermatology departments, of which the Royal London Hospital was the major hospital, but there were 7 other hospitals. They did a double-blind placebo-controlled study in which they have been able to show that they got 78% success rate using the Curaderm BEC. So the results they have obtained are similar to ours that we have obtained in Australia. Their studies went for 8 weeks. In our cases, we found that some patients have to be treated for about 12, 13, 14 weeks, depending how large the lesion is and what type of cancer it is, whether it's a BCC or an SCC. So I've analyzed their results compared to ours, and at 8 weeks therapy, 2 applications per day, we had approximately 80% success rate as well. So their success rate is very exciting, 8 weeks, 80%. And ours have actually gone to 12, 14 weeks to get 100%. So their studies, had it continued a bit longer, they would have had virtually 100% as well.
The cream is derived from the eggplant and the Australian devil's apple plant. The cream is applied to the skin twice a day and covered up with medical tape.
Cream is made out of vegetables, one of them being eggplant, and the other one being an Australian vegetable with which I'm not familiar, but still it's vegetable-based. And it is harmless to normal skin cells. That's very important, that it can kill cancer cells without touching normal skin cells.
BEC5 cream is virtually 100% effective according to our studies. The only reason it may appear to be less is if the patient has not treated the lesions appropriately or not long enough.
The known side effect from this cream is some folks get reddening and irritation when it's being applied of the normal skin, but that always goes away and the cancer goes away.
This new technology could give those with non-melanoma skin cancers an alternative to surgery.
BEC5 cream, when used properly, is extremely effective, and when used worldwide will revolutionize the treatment of skin cancer. I'm hoping that it will become available here in the United States so that it can be used not only for my patients, but for every doctor's patients. It's sufficiently effective that the amount of required surgery for skin cancer will drop dramatically, and yet the cure rates will be just as good, if not better.